Welcome to the Mayo Clinic video about surgical drain care. We hope this video answers your questions and concerns regarding your drain. Of course, this is meant as a complement, not a substitute, to the instructions provided by your surgeon. Should you have any further questions, please feel free to call us anytime at the number that was provided to you. At Mayo, we frequently use bulb drains in multiple different types of procedures to help remove fluid from the surgical site and to give us a window into the wound. This helps us assess the progression of healing. Drains are temporary in the vast majority of cases. The length of time a drain is left in place is dependent upon your procedure and your healing progression. For the drain to function, it must remain on suction. This is maintained by the bulb. When the bulb is collapsed, the drain is maintaining suction as intended. In order to recreate this suction, remove the occluding plug at the top of the bulb, squeeze the bulb, and replace the plug while still squeezing the bulb. It is important to record the output of your drain in the booklet that was provided to you. To empty the bulb, remove the occluding stop and pour the contents into a container that allows you to assess the volume. Place the drain back to suction using the steps described previously. Empty your drain 2 to 3 times per day or as needed unless otherwise instructed by your surgeon. On occasion, a drain may become clogged. This is especially common when fluid stays stationary in the tubing. To prevent this, it is important to strip or milk the tubing. Firmly grasp the tubing close to the skin with one hand, and then pinch and pull the tubing with your other hand towards the bulb. Keep repeating these steps as you gradually work your way towards the bulb. The frequency of drain stripping will depend on the type of drain and your surgeon's preference. Of special note, do not flush the drain tubing with fluid unless specifically instructed to do so. We do expect the output of your drain to change over time. The exact expected output is dependent upon the procedure. Though the drain may have more output on some days than others, it should be decreasing overall as your recovery progresses. The color of your drain is also expected to change over time. At first, we expect the output to have a maroon color to the fluid. However, it should not look bright red like fresh blood. You are also likely to note small stringy clots in your bulb at this time. After approximately 2 to 3 days, we expect the output to become lighter and more pink in color. Again, you may note small blood clots at this time, and this is completely normal. Over the next few days, we expect the drain to become even lighter in character and yellow in color. The stringy contents may become white now, but blood clots may still be present. As mentioned above, it is important to keep track of the output of your drain. If you notice that your drain is putting out much less than it was previously, please ensure that you strip the tubing as demonstrated earlier. If your drain still continues to have low output despite stripping, please call your surgeon or medical provider. Similarly, if your drain starts putting out much more than it did previously, please do not hesitate to call your provider. It is very important to remain vigilant for signs of infection. These include redness, warmth, or firmness around the side of the tubing where it enters your skin. Other signs of infection include nausea, vomiting, fever, or chills. Finally, please watch for any thickened output with the consistency of pus from around the tubing where it enters your skin or in the bulb itself. Pus is a thick, cloudy, white-yellow substance that may indicate infection. If you notice any of the above signs and symptoms, please call your provider immediately. We hope this video addressed some of your questions and concerns regarding your drain. As mentioned earlier, this is meant as a complement, not a substitute, to the instructions provided by your surgeon. We are always happy to discuss any further questions or concerns in person at any time. Thank you from the Mayo Clinic team.